Melasma. It's a common skin condition. You might know it as the mask of pregnancy. Melasma causes brown or grayish-brown patches on your skin. It's more common in women, especially during hormonal changes. But don't worry, it's not harmful. Melasma is a pigmentation disorder. It happens when your skin cells produce too much melanin. Melanin is what gives your skin its color. These patches usually show up on the face, especially the cheeks, forehead, nose, and upper lip. Melasma is a bit like a puzzle. We don't know exactly what causes it, but we have some clues. Hormones, sun exposure, and genetics can all play a role. Don't worry, we've got you covered. In this essay, we'll break down everything you need to know about melasma. We'll discuss its causes, symptoms, and treatment options. Knowledge is power. Let's get started. As we mentioned, melasma is a bit of a mystery, but we do know that certain factors can trigger it. Let's dive into the main culprits: hormones, sun exposure, and genetics. Hormones are often the main suspects in melasma cases. That's why it's so common during pregnancy. Estrogen and progesterone, the female hormones, can stimulate melanin production. This can lead to those telltale dark patches. Sun exposure is another big one. Those UV rays can really do a number on your skin. They can trigger melanin production and worsen existing melasma. So, wearing sunscreen is super important. And then there's genetics. If your parents or siblings have melasma, you're more likely to develop it too. It's in your genes. But remember, genetics is just a predisposition. It doesn't guarantee you'll get melasma. While anyone can get melasma, some people are more prone to it than others. Let's take a look at the risk factors. First up, gender. Women are way more likely to develop melasma than men. Those pesky hormones, pregnancy, birth control pills, and hormone replacement therapy can all increase your risk. Speaking of hormones, hormonal changes are a major risk factor. Pregnancy, as we mentioned, is a big one, but so is menopause. Those hormonal fluctuations can wreak havoc on your skin. Sun exposure, as we discussed, is another culprit. If you live in a sunny climate or spend a lot of time outdoors, you're more susceptible to melasma. Always wear sunscreen, my friends. Skin type also plays a role. People with darker skin tones have more melanin naturally, so they're more likely to develop hyperpigmentation disorders like melasma. Family history is another factor. Melasma tends to run in families. If your mom or grandma has it, you might want to be extra careful in the sun. And finally, certain medications can increase your risk of melasma. These include some types of birth control pills, hormone therapy drugs, and even some antibiotics. Diagnosing melasma is usually pretty straightforward. A dermatologist can often tell just by looking at your skin. They'll examine the affected areas and ask about your medical history. Sometimes, a dermatologist might use a special tool called a Wood's lamp. This lamp emits black light, which can help them see the melasma more clearly. It can also help differentiate melasma from other skin conditions. In some cases, a skin biopsy might be necessary. This involves taking a small sample of skin and examining it under a microscope. A biopsy can help rule out other skin conditions that might resemble melasma. Section 5. Fighting back treatment options for melasma. The good news is that there are effective treatments for melasma. The bad news is that it can be stubborn and require ongoing management. But don't despair. We'll explore some common treatment options. Topical treatments are usually the first line of defense. These include creams, lotions, and gels that contain ingredients like hydroquinone, tretinoin, and corticosteroids. These ingredients work by lightening the dark patches of skin. Chemical peels are another option. These peels use a chemical solution to remove the top layer of skin. This can help improve the appearance of melasma by reducing pigmentation. Laser therapy is a more aggressive treatment option. It uses focused beams of light to target and destroy the melanin-producing cells. Laser therapy can be effective, but it's important to find a qualified and experienced practitioner. Section 6. Sunscreen is key. The importance of sun protection. No matter what treatment you choose, sun protection is crucial for managing melasma. Remember, sun exposure is a major trigger, so shielding your skin from those harmful UV rays is essential. Wear sunscreen every day, rain or shine. Choose a broad-spectrum sunscreen with an SPF of 30 or higher. Apply it liberally to all exposed skin, even on cloudy days. Don't forget to reapply. Experts recommend reapplying sunscreen every 2 hours, especially after swimming or sweating. And don't rely on sunscreen alone. Seek shade when possible, especially during peak sun hours. Wear protective clothing, like hats, long sleeves, and sunglasses. Section 7. Preventing the mask proactive steps for a clearer complexion. While you can't completely prevent melasma, there are steps you can take to reduce your risk and manage it effectively. Let's discuss some preventive measures. Sun protection, as we've established, is paramount. Make it a habit to apply sunscreen daily, seek shade, and wear protective clothing. Hormonal management is also important. If you're pregnant or considering hormone therapy, talk to your doctor about the potential risks of melasma. They can help you weigh the pros and cons and explore alternative options. A suitable skincare routine can also make a difference. Look for products that are gentle and non-irritating. Avoid harsh scrubs or products that contain alcohol, as these can worsen melasma. And finally, be patient. Melasma can take time to fade, even with treatment. Don't get discouraged if you don't see results overnight. Consistency is key. Section 8. Understanding for a brighter future. Melasma is a common and often frustrating skin condition, but by understanding its causes, risk factors, and treatment options, you can take control of your skin health. Remember, knowledge is power. The more you know about melasma, the better equipped you'll be to prevent and manage it effectively. Don't be afraid to reach out to a dermatologist for personalized advice and treatment. With the right approach, you can achieve a clearer, brighter complexion. Stay informed, stay proactive, and embrace